Welcome to Startup Diaries, sponsored by PointClick Technologies. My name is Zainab Sise, and this is a new series highlighting 10 Gambian founders and their startup stories. Each episode has an in-depth interview with the founder, highlighting their ups and downs throughout their journey. Whether you are in the Gambia or somewhere out there in the diaspora, this show is for you. Please do not forget to like, subscribe, and hit that notification bell so you never miss out. If you have any questions or comments, please put them down below, as we would love to hear from you. Enjoy the show.
So my name is Ismail Badjie. I am the founder and CEO of Innovarx Global Health, a startup healthcare company that was started in 2015. I was born in the Gambia, Banjul, spent most of my childhood years here, but also spent half of my life in the US. Yeah, so the name Innovarx actually just means a new solution. So the company is just a new solution to global health. I think as a US practitioner, my professional background is a doctor of pharmacy. I was practicing in the US in the communities and started seeing how technology was changing the way people had access to healthcare and saw that as an opportunity. I think any startup, you're in the business of finding solutions. And healthcare problems, not only in Gambia, but the entire continent, speak for itself. So just wanted to find a way to leverage knowledge that I knew working in the communities, technologies that were being made available, and just trying to make healthcare as democratic and accessible as possible with people that look like us in mind. Yeah, so a lot of the engineering started with thinking about a 56-year-old grandmother who lives somewhere in the Gambia but has diabetes or hypertension, right? And I think that's always the model case for the people that we care for. What does that grandmother need to live a long and healthy life? So access to quality medications, obviously, that are not counterfeit and do what they're supposed to do. Access to good doctors that could, help not only with the diagnosis, but the management in collaboration with a pharmacist, a nurse. Access to reliable diagnostics from a point-of-care testing standpoint. Technology made that a whole lot easy. And lastly, accessible. Like if the grandmother does not have a car or lives somewhere remote in a rural area, being able to receive the same level of care, access to products as somebody in an urban center. So that's how the evolution of Wellness on Wheels came about, as an at-home, last-mile delivery of products and the services. Yeah, so market research in Africa is non-existent. You could have a hunch, but for most cases, if you're looking for traditional ways of getting research to the market, it's impossible. But also the way we define a market, in my case, was different. Because most startups, they tell you, where are you going to launch your product? See who lives there, who needs the products and services. We have a business where half of our clientele actually are Gambians in the diaspora. So we not only saw the Gambian market as limited, but also an opportunity to expand it to include a lot of people who live abroad, who all had the same pain points. I think what we did was ask around in the Gambian communities in the US, for example, how often are people sending money back home for healthcare, but don't have an ecosystem where they actually spend money back home on healthcare without the traditional remittances? So I think that gave us a hunch to realize that a lot of people have the same pain points in terms of who and where they could get care, but also making it easier for them to participate. And I think that evolved as we also started getting to know more about, their market, the Gambian local market. Only 4% of the market having health insurance. We saw that as a huge opportunity. So yeah, it's very organic the way you get market research. So yeah, typically marketing would have been very expensive, but a startup, one feature of a startup is you don't have a lot of money. So you have to be very creative. And I think what we leveraged were obviously social media, which is free, and you could use it to your advantage if you, kind of fine-tune your messaging. But we started speaking directly to people that we knew shared the same pain points, but also providing value. So as a company early on, we did a lot of things in terms of providing health education. We went into communities in the diaspora, communities in the Gambia, talked to them about, non-communicable diseases, for example, which is like diabetes, hypertension. So just kind of meeting people where they are and providing them value without even expecting, them to convert into customers. And I think that's been a secret in terms of just speaking directly to their pain points. And also, after a while, the problems that you're solving also have a very organic way of creating additional marketing. But definitely social media, in person, all those aspects went into the business. Yeah, I think from early on, we understood what a customer acquisition cost is. And one of the things that we did that I think worked really, really well for us, when we were starting, we knew there'll be a cost associated with it. But we decided to make screening for diabetes and hypertension free of charge. So we started a What's Your Number campaign, and to date, we've screened thousands of individuals at no cost just by adding value to their wellness. But in that process, we not only found out individuals who had these conditions but did not know, but the ones that actually had problems that needed solutions, we had solutions tailor-made ready for them. And I think our business model was so agile with the ability to include people in the diaspora who could now sponsor the care of their loved ones. It just made it really, really easy to find new customers, but also in the process adding a lot of value to them as well too. And it's worked out relatively well. Obviously, there's traditional means of finding customers through marketing, but I think even from a corporate standpoint too, finding out that there was a gap in the market because a lot of companies did not have structured programs to help increase wellness. So all those aspects went into our lead generation, and we've kind of just stayed in that angle of providing value first. And if for 10 people that we provide a free service, even if we could help 2 people, then it's a more structured acquisition strategy. Yeah, so heavy on technology and tools. So right now we use a really sophisticated cloud-based electronic health record system that also is an innovation in the market, because now every single customer, even if it's as simple as your temperature that's checked, we have access to be able to provide you continuity of care. So that evolves into a relationship from a customer standpoint, but also the traditional ways of CRM tools that we use, be it HubSpot, MailChimp. A lot of those aspects just go into just maintaining that relationship with people, that because the company is so broad and wellness means something different to every single individual. But being in a position to always allow them to define what health and wellness means to them and helping them create that has just allowed us to kind of stay in contact with a lot of individuals from a relationship standpoint. Yeah, so I think one feature about Gambia, or even the market, the Africa market, is you can't just focus on product development as an entrepreneur. You actually have to invest heavily in human development, like investing in people. Like that could be providing them one environment that's conducive to growth, paying them a living wage, which sometimes is forgotten in the ecosystem, but also giving them ability to practice or do whatever skills they have at the top of their ability. So I think that the significant amount of energy went into the first 2 years of just investing in building a core group of people that, one, aligned with the vision of the company, but consistently creating an environment that stimulates growth. So as much as you could develop your product, you could have amazing services, if you do not develop and invest in the people aspect of the business, that's when the execution fails. So creating a culture of excellence, always begins with a deep commitment to people that work in the company, because it's only as good as the people that you have. So it's definitely a healthcare company, but I like to believe it's also been a human development company, just based on the amount of young, talented individuals who are the backbone of the company. So today, their role and what they do is more significant than the idea I had 10 or 15 years ago. There's aspects to a business that even before you find a customer, your legal foundation has to be strong. Any company that's not built on a strong legal foundation will crumble. So with that said, Innovarx Global Health USA, which is the parent company, is a limited liability company. It's an LLC. The same structure was set up in the Gambia as a limited liability company. And it's important when I distinguish that unique feature about the company, because we took 5 years of building the legal framework around the business before we had our first customer. So that has kind of stayed with the entire company. So understanding that if you have an idea, you have to protect it. So every conversation, you need to have an NDA signed. Finding a good lawyer that you will invest money in, who knows how to structure your company if you want to seek investments. How many shareholders do you have? Employee contracts, making sure they understand what a contract is, a legally binding document. So there's so many aspects of the business, which for me is finding the right people who are professionals and getting out of the way as a founder so that they could help guide the vision or the structure. Because then if you get to a point where you want to scale or you want to invite new investment, most of the due diligence process that happens, they'll kind of open the hood and see how legally sound the company is. So it's extremely important. And once again, just find a good lawyer. And that's one aspect where you should do more listening than actually talking as a founder. Yeah, so money is always uncomfortable to talk about in an African context, but you're in business to make money. You need money to make money. So obviously we've invested, obviously as a founder, the first investment always starts with you through sweat equity, through your initial capital. But very few people could come up with $250,000 to get a startup up and running, which is what it costs for this to happen. So that came with, seeking investments from friends and family through a seed round. So also as a founder, just understanding different avenues of raising capital, be it selling a little bit of your company for equity or giving people convertible notes. You have to be very sound going back to the legal framework to understand how could I raise money. So all those aspects come into play until the company is now able to generate revenue that you could use the revenue to sustain the business. But you'll still go through phases where you'll have to keep on raising funds. So as a founder, honestly, the fundraising journey never ends. And for us, we've kind of gone through every single iteration of raising money, from when it was a piece of paper and an idea, when I was selling 1% of the company for X amount of dollars, to now having conversations with more sophisticated investor firms to kind of usher in the scaling up part of the business. But finances is something, as Innovarx, we're very transparent. We make people take ownership of what the company is making, where the company is getting money from. Because I think it just allows everybody to kind of buy into the vision and know that, once again, you need money to make money, and you're only as good as the customers you have. So it funnels into different aspects of the company. Any individual that you have an idea that's ambitious, like Innovarx Global Health is, and you tell them you want to choose Gambia to get started, I mean, first of all, it's one of the worst places to do business for obvious reasons. The market is not big enough. From an investor standpoint, it's not a sexy market. Africa is the great unknown. So there's a plethora of challenges. But I think also what's important to understand is, if you have an uncomfortable relationship with discomfort, with challenges, then being an entrepreneur is not something you should do. So you embrace the fact that there will be challenges along the way, but I inherently believe that if your idea is strong enough, if the problems that you're finding solutions for are strong enough, they will always supersede any challenges that are in your way, and you focus on that. So I think you embrace the challenges as learning opportunities. It shows you the character of the company, the character of people who work in it. And you focus on providing value, because the value, as long as you continue providing value, you find ways around the challenges. And then what becomes a difficult market to navigate, your idea becomes a new version of a solution that does have staying power and starts defying the odds. So I think there's a bigger cause to it, where if Innovarx, does succeed and has staying power in the Gambia, it could, give way to a lot of investors down the line to hear Gambia and not turn away. So a lot of challenges that comes with anything, bureaucracy, red tape, you name it. But I think we've always focused on the value that we're creating. And the journey has been tough, but also it's brought us closer as a company. And it's just showed us that what we're doing is the right reasons. We're providing value. We're helping make healthcare more accessible. We're leveling the playing field. So all those things keep us going. Opportunities. So I think with any market where there's a lot of problems, a lot of opportunities exist. And I think the reason why innovation is so good, because it causes tension into the environment, where now every healthcare company that starts up, you have a new standard in terms of how care should be delivered. Customers have a new expectation on what good looks like. And also, there's a value in understanding that no matter how small our market is, in Gambia, for example, we are able to not only create an idea that adds value, but now be able to compete on a global scale, where now how we're delivering healthcare is actually better, arguably, than even some of the Western countries, because we're able to meet people where they are. So I think the fact that we're in an environment that there are a lot of problems, a lot of opportunities will continue presenting itself. And it's always nice to be in a position to take advantage of those opportunities as well too, because where Africa is going from a healthcare standpoint, most people that are taking the hard road now will own the space in 10, 20 years, and our intention is for Innovarx Global to be at the forefront of that. Yeah, so from day one, Gambia was a pilot country. Small population, 2 million people, small market, it's not attractive to a lot of investors. So it was always a proof of concept. Do we have something that's valuable that people will pay money for? So the first 2 years of the company was designing systems and building people who could execute the vision that we have, which we've had a lot of success in that. Now that has led to expansion phase, because from day one, the reason why it's a new solution to global health, we've always wanted to be the largest health ecosystem in Africa that allows participation from Africans from all over the world. So the way we deliver care now, we're looking to expand into more markets as well, to be it Ghana, Nigeria, Sierra Leone, Liberia, because all Gambia's problems is just a microcosm of what West Africa problems are. And the solutions that we're offering, there's a market for it, honestly, anywhere in the world. So we're very intentional, but also cautiously optimistic about how we're growing. So yes, expansion definitely, because I think Gambia, we've gotten to a point where we know what we have works. We have systems that we believe in. Our business model is agile and innovative. So the next 3 to 5 years, we'll definitely be looking to expand into the region and just see how we could keep pushing the envelope on making healthcare not only democratic, but also on an equal playing field, where now Africans who live on the continent would not envy the way healthcare is delivered in other parts of the world, and wellness becomes something that everybody has access to. Yeah, so I think the most important aspect of a startup is your experience before you choose to start up, and it's apprenticeship. I think a lot of times we could rush to want to be an entrepreneur, but I think being in an environment that allows you to learn and hone in on some skills that allows you to be the best at doing something or understanding processes, learning a trade, putting in the 10,000 hours that people tell you you need to kind of achieve mastery at something before you even jump into being an entrepreneur. So behind most entrepreneurs lies a good employee that somebody had as well too. And so much of my journey was influenced about the experience that I had as a pharmacist, as a manager for Walgreens. So I had 10 years worth of experience in the industry before I decided to start Innovarx Global Health. And I think that's such a huge aspect of a founder's journey as well, to believe in following individuals, learning as well, to continue learning outside the scope of what you kind of even went to school to do. But fundamentally, you just have to be patient, because we've operated for 2 years, but the company has been around for 7 years. So it took 5 years of sharpening your axe. That way, as an entrepreneur, once you strike at the right time as well too. So I think that's just a message to be patient and believe in your why. What you do is going to change. How you do it is going to change. But why you do it, if that's not strong enough, that's where problems lie, because the going will get tough. Ask me.
Oh, that's good.
That's good?
No.
Did that answer the question? Or what was the question?
So basically, what challenge with the challenge that came up?
Oh, okay. Yeah, I could add a little bit to that. I could add a little bit. Right. Cool. There you go. All right. How many minutes was that?